Hi folks, I just wanted to give everybody an update on the COVID situation here in East Brunswick. I know that it's been several months since I've been here in front of the camera giving you such an update, but the reality is that after the lockdown and the massive number of cases that we saw earlier in the pandemic, the reality is that for the most part, the case rate here in East Brunswick has been relatively low. And with the executive orders from the state in place, there was really very limited information that I was going to provide you that wasn't already being provided to you through the newspapers, through social media, and through the Middlesex County website. But I know that there's been a lot of chatter in social media and a lot of talk since schools opened that there's an uptick and when you in numbers, and when you look at a lot of data across the country and across the state, it would lead people to that conclusion. So I thought that this was an appropriate time to really get back in front of the public and give them the update that they need in terms of where all of that fits right here in East Brunswick. So the first slide is a slide that comes directly from the CDC, and that's case rates for COVID throughout the country. Now, most of us know who've been following the news that the initial outbreak was in the spring. That's what caused the lockout here in this part of the country, New Jersey, New York, the whole tri-state area. And then we actually saw a reduction following the lockdown, but because there's no national plan, we actually saw that the uptick occurred in the south. And that's where you saw over the summer that second peak that took place in the south. And now again, without a national plan in place and not everybody following guidelines, we're now starting to see an uptick for the third time, mostly in the Midwest, some of the northern states. And I'm not going to get political here. This is not the forum or format for us to do that. Clearly, of an election coming up in 2 weeks, that verdict will be out at that point. But let's now look at the case rates right here in New Jersey. And as you could see, our case rate dropped dramatically after the spring. And we are noticing that there's a slight uptick in case rates. And the governor's been making a point about this, whether or not that's all confined to college-age kids, whether that's specific clusters in the state, whether or not that is specific age groups. I don't really feel that we're able at this juncture to determine that. There's clearly epidemiologists and statisticians that's their full-time job, and that's the type of information that they're providing at the state level, and that information is going to guide the decisions that the governor makes. But the third slide is actually case rates here in East Brunswick. And the black line is the 7-day average. So compared to the country and compared to the state, we can see that it's been clearly relatively flat throughout almost the entire summer. And from the bottom blue line to the top blue line are 5 cases. So a little uptick really is a half a person or a person change from the summer to now. But if we actually concentrate closer from August 1st to the present time, the fourth slide is really actually concentrating on our most recent trends. And as you could see from that slide, we could argue whether there's really a significant uptick in East Brunswick over the last couple of weeks, specifically targeting start of school, which is the biggest question that people have had, is what was the effect of school going to have on our numbers here in East Brunswick, considering that we're the only school system in Middlesex County to have had in-person instruction starting at the beginning of the school year. If you look at the numbers, and we study this all the time, there doesn't seem to be any cluster in any specific area of town. There's not a cluster in age groups in terms of our cases. Among the school-aged children that were diagnosed, there's not a cluster within any one school or within any one grade. But the reality is that East Brunswick, in comparison to Middlesex County or the state or the country, just isn't a large enough sample size for us to be able to make any statistical conclusion from the numbers we have so far. And whether that can be a slight change as a result of more availability of testing. It's just too hard to tell from this sample size. But if you look at the ages, and I have on this last slide I'm going to show you, the age groups and incidences of COVID for August, September, and October. Now keep in mind that October was only a half a month. But what we can look at when you look at this age distribution is that in the age group of equal to or under 18 years of age, which would encompass our public school age children, you could see that from August, when there wasn't school, to September, when there was, there's actually a drop in incidences of COVID. Whereas in almost every other age group, other than older individuals, there was actually an increase. And if you look at the October numbers as only half a month, you could also look across age groups almost up to age 50, and there's just no difference in the number of reported COVID cases based on age group. So I would have to say that, considering that we are the only school system in Middlesex County to open with in-person school, I can't be able to say from the numbers that that has been a detriment, that there's been any increase in the number of COVID cases within that school age population. And I think that our Board of Education and the superintendent need to be commended for putting in a hybrid program that's followed all of the guidelines, whether it's hand washing, social distancing, and mask use, has actually been able to prove that we're able to open up schools in a safe manner and have been able to keep cases to a minimum number. And while you may have heard robocalls from the superintendent or reported cases, people are acting responsibly. When there's an individual who's been identified or been in contact with somebody, we're reporting them appropriately. We're isolating those individuals and quarantining them. We're identifying the contacts, and the superintendent is making the township aware. We're doing exactly what we're supposed to be doing and what we promised we would do in terms of transparency and being open. And it's paying off because we've been able to keep our schools open in a safe way. And I cannot say from the data that opening schools has resulted in any increase in numbers of cases in COVID in the schools or in East Brunswick in general. Now, what we are doing, and it just started today, is adding another level of security and safety to our school-age population of not only students, but our staff who have to be there every day, support staff, and our administrators who are in school regularly. And what we've done is we've partnered with with Middlesex County, and we did our research and worked with the United States Air Force. Shout out, by the way, to Colonel Douglas Wickert, who put together at the Air Force in Colorado a pandemic math team made up of statisticians and epidemiologists and biologists to calculate that within a body of people, what number and frequency of COVID testing can be added to the guidelines that we're already complying with in order to keep schools open and prevent any spread of disease. And we've used and borrowed their expertise, their formula, plugged in our data, and came up with a frequency and number of tests that we are going to be offering in the East Brunswick public schools. That's been already put out by the media, and we're proud of that program. Again, that's starting today. By testing approximately 15% of the population weekly, we're hoping that we can identify people who are asymptomatic early enough that we could pull them out of school, identify their contacts, and be able to keep school functioning without an effect or a super spreader event, which could result from people that are asymptomatic spreading it to others unknowingly. I want to thank the County of Middlesex for providing the saliva test. The saliva test, as you know, was actually developed right at Rutgers in our backyard. The test is going to be available to everyone in the school system for free. Results are generally provided in 48 hours. And what we're doing is the county is partnering by providing the first round of testing free, roughly 6,000 tests. And if and when we see that it's been successful, we're going to study our data. If it determines at the end of our review that the frequency needs to go up or the number of tests need to go up or down, we could adjust that, but we'll do that based on the science and the data and our results. But I do want to thank the county for providing that first round of testing. If it's successful, our goal is to convert over to private pay insurance, which most of our faculty, staff, and students have. COVID testing is covered 100%, no copay by almost all insurance companies. That's required by law in the state of New Jersey. And for those that don't have insurance, it would be our goal to find charities, religious groups, civic organizations to pick up for those tests, the cost of those tests for those that don't have insurance. There's also been a question, is this voluntary or mandatory? Well, we can't make the test mandatory to everybody. It's completely voluntary. But statistically, if there's a large enough people that are participating in the program, if a handful of people choose not to have the test done, it's inaccurate to say that the results would not be valid. The validity of the test is based on the number of people that are participating, and statistical significance will be based on, again, the number of people participating. If a handful of people decide that they don't want to participate, it doesn't change the ultimate reliability, validity, or statistical significance of a large body of test results. So I'm looking forward to that coming to fruition. I'm anxious to see how that works. The logistics is something the school is working out. And again, I think it's a great program. We're the only program, to my knowledge, doing this in the entire state of New Jersey. As we look around the township in terms of what's been going on in terms of different departments and our response for COVID, one of our biggest concerns has always been the business community and making sure that we did everything possible to give them the support that they need when clearly they're being hit the hardest. One of our main goals of our economic development officer has been to support local businesses. Our economic development officer is Kenny Armwood, who also serves the county as the deputy director of the Middlesex County Board of Freeholders, which actually after the new year, freeholder term will actually go away and they'll be referred to as county commissioners. But his role here in the township has been to provide the support that we need for our businesses, coordinating with the Chamber of Commerce, the County of Middlesex, the state, and the federal government to do everything we possibly can to provide information on loans and grants and any type of support that we can provide for our local businesses. In addition, he's also worked with our township planning and engineering department. As you know, when restaurants were allowed to open during the summer and the gyms, we wanted to make sure that all of the businesses that needed to comply with new guidelines were able to get help from our planning and engineering department, and that was coordinated through his office and our department, and it was all done free of charge to make sure that we were able to get our businesses back and operating as quickly as possible. And despite all the rumor and the negativity, the reality is that we're actually still seeing new businesses come in to East Brunswick, even in the middle of a pandemic. Clearly, sometimes situations provide opportunities for new businesses, and we've actually seen that happening right here in East Brunswick. With our Parks and Recreation Department, even from the very beginning of the pandemic, despite what was being done on the state level, we've kept our parks open. We have beautiful parks. In the middle of a lockdown, I really felt as a physician, it would be important for our mental health and for our physical health for people to get out, walk, jog, run, bike, just get out of the house. Change of scenery. And people were overwhelmingly supportive, cooperative, followed guidelines. There was never a reason for me to ever entertain having to close our parks down. But Parks and Recreation Department continued to work throughout this pandemic, and they still do. Our pool, our public pool, was open. We followed guidelines that were provided to us. We had to have a limited attendance. But while other townships were closing public pools, while many apartment and condo associations were not opening up their pools, ours was open. And guess what? We didn't see an increase in COVID rates among people utilizing the pools. We were not forced to close down. None of the people working for us came down with COVID. So clearly, with following the guidelines, being responsible, we've been able to provide services when many other townships have been cutting back. The other thing that we are doing is in September, we were able, based on our good results, to start to open up our basketball courts, to open up the public playgrounds, even got cooperation with some of our organized sports to open up park bathrooms. We've worked together to make sure that we kept it clean and followed guidelines. That's what happens when we work together and we are cooperative and we do the right thing. We're able to show that we're able to do this and do it safely. The other thing that we've been running through our Parks and Rec department is a flu shot program. Now, as a physician, I have to tell you that I believe very strongly that it's important that all of us get flu shots this fall. Clearly, we're not done with COVID, so an infection like that on top of the flu could be deadly for many people in the community. But with that even not considered, those who get flu shots tend to, even if they get the flu, to do better than those that didn't get a flu shot at all. But we don't, again, want cost to be a barrier. So the townships provided free flu shots. It's covered by insurance if you have it. We're providing them over at the Community Arts Center. We've done 2 out of 3 sessions already. We've had hundreds of residents that have been vaccinated. For those that don't have insurance, the cost is being waived. For those that do have insurance, we're accepting whatever insurance covers. And we have one more day left that's open to the public. That'll be on October 23rd. And that's going to be at the Community Arts Center from 12 o'clock to 3. The only thing that we're asking you to do in order to move people through more efficiently is to download the online consent form, because if you have that filled out ahead of time, it will help those that are administering the program get people through the line faster. We've already vaccinated our employees, again, on our insurance, and we're doing this again also for our senior population. So clearly, the department is doing what we can. We're staying on top of COVID and trying to do the responsible thing. We've had virtual programs that have been running through multiple departments, even when buildings were closed. Parks and Rec had tons of them over the lockdown, and they're still going on. We've had it done through our senior center for our seniors, whose building was the first to close down in the pandemic. Our library has never closed. It's always been available online. It's always been available by call. In the summer, when we started to do outdoor pickups, the library has been functioning and it's been enormously popular. And then we were most recently allowed to open up the building with limited capacity, but we're seeing several hundred people every day here at the library, and they're enjoying all the services that they had before. Computers are available, reading rooms are available, but we're following the guidelines, and yes, so far we've not seen any uptick in COVID cases, and so everybody's been behaving and acting responsibly. Our municipal building, which closed early, everybody was sent home with computers. It's actually, that early action has kept our township rate of infection extraordinarily low. Our healthcare expenses for COVID has been minimum. As of the end of August, we've only spent about $60,000 since we're self-insured for COVID cases, and 40,000 of it was a very early individual who was sent to the hospital and discharged. We've had a total of 8 cases of COVID. Remarkable, but it's all from following guidelines and acting efficiently and doing the right thing, and everybody following. Now, that building, we now are planning to try to open by Election Day. The delay has been the fact that we needed to put some equipment in place that will help prevent spread of COVID, and as you can all imagine, a lot of that stuff is back ordered, and so it's been very difficult to get it. But once that's in place, our anticipation is for the building to open on limited hours by Election Day. As far as future updates, Obviously, that's all going to depend on case rate, transmission rates here in East Brunswick and within the county. And so we'll have to keep a close eye on that. Obviously, I want for us to continue on the track that we're on and keep our infection rate very, very low. Maybe we'll have a vaccine or a treatment, whether it's before the end of the year or after the end of the year. Obviously, I want the data to confirm that it's a good vaccine. But we'll work with our health advisory committee to make sure that once that's available, how is it going to be distributed? Who's going to get it? Will the township work just like we did with flu shots to help get out vaccines to people? All of this is yet to be determined, but it's clearly the type of stuff that's on my mind to make sure that we keep the lines of communication open and for a transparent form of government that you know exactly what's going on and not depend upon social media for that information. That's my responsibility. Will there have to be more restrictions? Will restrictions go down? Clearly that depends upon case rates, transmission rates, and that's all something that we have to keep our eyes on. But I can promise you that I know that my number one responsibility always has been, is, and will continue to be your safety. So with that in mind, God bless all of us in this community, God bless our township, and God bless the United States of America.